Hello, my name is Al Ali, and I want to talk to you today about mastopexy or breast lifts. Often, but not all the time, women that have had babies, their breasts do not stay in their original position, a little higher up on the chest wall, and they will tend to drop down. The medical term for that is ptosis. Many women, when they get pregnant, their breasts grow, and then the breast deflates once the breastfeeding is done. And often that's at least one of the major reasons that the breasts fall. A couple of different times in a woman's life that she's thinking about changing her breasts, and sometimes if very small breasted women, before they have any babies, they'll think of breast augmentation. The other time that women think about having something done to their breasts is after they've had a couple of babies, they're not interested in having any more babies, but their breasts are in a lower position. The lifting component is going to take a lower position breast and move it up into a higher position. The position of the nipple, the area around the nipple, is called the areola. Where is it in relationship to the crease that's underneath the breast? If it's at the level of the crease as you project that crease to the front, generally that means you're not ptotic or you're not droopy. If the nipple starts to drop, and sometimes it could be a little bit lower, sometimes it could be very low, all the way down to where the nipples are pointing to ground, that's usually when you require a lift of some sort. It's important to understand that lifting does not do a major thing that some people want. So a regular breast lift will take your breast and make it into a more ideal shape of the breast. So the ideal shape of the breast, if you look at it from the side, is if this is the top, it goes down to the tip, and the greatest projecting point should be the nipple. And then there's a curve that goes underneath. And in essence, it's at the level of that crease. When you do a lift where the nipple was way down here and you bring it up, the top of the breast here is not affected. It doesn't fill that area out. This is the upper pole, which is the upper aspect of the breast. And that usually is not helped by a lift by itself. So you either need to put an implant in, or if there's enough fat in the body, you can steal some of that fat and inject it. But most of the time, I would say it is with an implant. So if your desire is to lift the breast and also get upper pole fullness, then you usually are going to require an implant to do that. In most people, you're able to do a lift and an augmentation together. There are certain people, at least for me, that I don't like doing both together, and those are usually massive weight loss patients. Now, the scarring associated with pure lift, let's say we're not worried about the implants now, the minimum, and we don't often, at least I don't often use that, is the scar that goes around the areola, which is the colored part. Most of the time, you're going to have something that looks more like a lollipop, which is going around and having a vertical component. And most of the time, you're going to have something that looks a little bit more like an anchor. So it goes around the nipple and areola, comes down, has a horizontal component. Depending on the size of the breast, how much lifting one needs to do, these incisions will be different. A breast lift is that it's associated with a lot more scarring than a breast augmentation. Breast augmentation is usually a fairly small scar, fairly inconspicuous. In desiring a lift, you kind of have to understand that you're going to have to deal with a lot more scarring on the breast in the first place. I hope this was helpful for you to kind of understand what a breast lift is. There's obviously a lot more detail. You can get that when you're actually sitting with your doctor. Thank you.